Hi guys, Wendy with MobiliQuest. We are here today with Dawn Dalton. She is with Family Hospice. She has been doing all things hospice for 19 and a half years now. So I'm just going to ask some questions. First of all, thank you, Dawn, so much for being here with us today. I'm just going to jump in and ask some questions and hopefully get some answers for you guys that'll be helpful. First of all, what exactly is hospice care, Dawn?
Hospice care is end-of-life care, and it is funded by primarily Medicare, but most private insurances have a hospice benefit. Medicaid has a hospice benefit, and we accept patients who are unfunded as well.
Okay.
So it is end-of-life care, and when I say end-of-life, most people are terrified of that, and most people think cancer. Well, obviously you can die from other things from cancer. So there's a lot of diagnoses that would qualify you for hospice care, and Medicare says to be eligible for hospice, it is reasonable to expect a life expectancy of 6 months or less.
Okay.
None of us are God. None of us know when that time is going to come, so no one gets in trouble if a patient lives longer than 6 months. We actually think that's a great thing. And there are people who actually graduate off of hospice care because they get too well to be on our services, which is another great thing.
Yeah, awesome. All right, so when should hospice care start?
So patients who are thinking that they're tired, they're ready to give up their treatments, they don't want to seek any more aggressive care, they're great candidates for hospice care. Or caregivers who are exhausted. Dementia, there's not really a treatment, but if someone's no longer walking, no longer talking, no longer able to feed themselves, and the caregiver is just absolutely exhausted, that's a reasonable time to call hospice care. And anybody can make a referral to hospice care. It doesn't have to be from the doctor. We do have to have a doctor's order. I will have to contact a doctor to get orders and paperwork and all that fun stuff that Medicare requires, but anyone, you, Richard, anyone can make a referral to hospice.
Okay, all right, good to know. What services are provided in hospice care?
So in hospice care, we offer a nurse. Our company offers a nurse at least twice a week to begin. And as we get to know the patient and the patient gets to know us, that number could go up or down based on what the patient needs. They also get a CNA, which is a certified nursing assistant, and that person is there to help with the patient's personal needs, meaning bathing, grooming, changing the linens on the bed, picking up around the room, maybe making them a sandwich, something like that. The CNA will do that, and that person can come anywhere from one time a week to several times a week based on what the patients choose, or families. And then they also get a chaplain and a social worker, and those people are there for spiritual care, counseling needs, community resources for the patient as well as for the family. And we also offer volunteers. The volunteers don't do any hands-on care, but they can come sit with the patient, visit with the patient, run errands for the patient. They can also, volunteers also work in our offices and help us do some things in our offices.
Wow.
And Medicare pays for the services 100%. So families never get a bill from us.
Oh, that's fantastic.
Yeah.
And where does hospice care take place? Is it always at home?
It is not always at home. Medicare wants it to be at home. And if you read the studies show that families want it to be at home because that's where the patient is the most comfortable. They are in their home with their stuff, with their people, with their fur babies, and that's where usually they're the most comfortable. We do offer inpatient hospice. Inpatient hospice is like the hospital for the hospice patient. You have to have a reason to go there, just like you have to have a reason to be in the hospital. You have to have a reason to be in an inpatient unit. I get calls often from family members who say, my mom just needs inpatient because I can't take care of her. I'm sorry, but Medicare doesn't see that. Medicare doesn't pay for that. You have to have a symptom that actively needs to be managed. We do offer respite care, so those caregivers who are exhausted and just can't anymore, we can provide respite care, and respite care is where we send the patient either to an inpatient unit or to one of our contracted Medicare licensed facilities like a nursing home, and they can be there for up to 5 days per benefit period. And we would go over all that with the family.
Okay. So should hospice care be included in like end of life planning?
Yes.
Okay.
Absolutely. You do your will, you do your advance directive, you tell people how you want to be treated at the end of your life. You tell your people what to do with your stuff after your life. You don't make plans for yourself. And yes, my daughter knows when it's that time, you call hospice.
Okay.
It's huge.
It makes sense.
Yes,
Yeah.
it does.
So you sort of briefly mentioned this a little bit earlier, sort of touched on it. Does the patient continue to take medicine in hospice
Yes,
care?
yes. So we pay for all medications that are related to the hospice admission, the admitting diagnosis for the patient. And the nurse goes over the patient's medications with our doctor, and they review what is and is not related. We also pay for all medications that are related to comfort measures. So anything for pain, nausea, vomiting, anything like that, we pay for as well. We also we make recommendations on medications to stop, but it's always up to the patient and family if they want to continue those medications. If it's something that we recommend stopping, it means it's not related to the hospice diagnosis. We would not pay for those, but families can continue to pay for those. Families can continue to get those medications the same way they have been getting them, and our doctor will write a prescription for those medications, even though we're not paying for it, because we know that the patient can't go to the doctor's office. You call the doctor's office and say, I need a refill, and they say, well, you have to come in.
Right.
We know that that's not reasonable. So we'll call in a refill, write a prescription refill, whatever, for even if we're not covering or paying for the medication.
Okay. Is hospice care 24/7 care?
No. Most people think it is. A lot of people call and they want us to just come out and move in. It is intermittent care. The nurse goes out, she does her job, she's checking vitals, she's making sure that the patient is comfortable, she's ordering medication, she's reviewing, making sure that the patient doesn't need any additional equipment or anything like that, and then she leaves. The CNA goes out, she does the personal care, the bathing, the grooming, the changing the linens on the bed, picks up around the room, and she leaves. They go to their next patients. Same with the chaplain and the social worker. They're there for an allotted period of time to do what their assigned duties are, and then they leave. The only time that it would be 24/7 would be if they were in an inpatient unit because they had a symptom that was out of control. We also can do what's called continuous care, crisis care, emergent care in the home setting, but the same thing that qualifies you to go to inpatient would require for our staff to come in and be there around the clock just for a small set period of time until the crisis was over.
Okay. All right. So if you guys aren't there 24/7, is it possible, or do you know if Medicare would pay for another company to be able to come in to be there on a more continuous basis at the same time hospice care is happening?
Medicare does not pay for that.
Okay.
Medicare does not pay for that. You can private pay or have long-term care insurance and use, you can use a private individual or you can use companies that are bonded and have multiple caregivers so that if somebody calls out, you're not left in a lurch. But that is typically private pay or funded by your long-term care insurance. It can also be funded by the VA, but there are parameters that with the VA you can't have over a certain number of assets or a certain amount of money.
Okay, gotcha.
Yeah.
So what is the difference between hospice care and home care?
That's a loaded question because a lot of people lump a lot of things into home care. So home care, by definition, is like a sitter service. It's the people, it's companions that come in and sit with you and visit with you. Then there's home health, and a lot of people lump home care and home health together. Home health is skilled nursing care for people who are still doing aggressive treatments, for people who are homebound, for people who need a little extra care in the home. And then there's home hospice care, which is what we've been talking about. So there's different levels of home care, but home care by definition is like sitters, companions, people who come in where you do the private pay, people who come in and help with those things that you can't really get done in the home anymore.
Gotcha. And not necessarily more end of life, more like hospice
Right.
is more within 6 months, you said.
Correct.
And so the home care could be
Home
just
care could be
anytime.
anytime.
Gotcha. Okay. All right. Well, that's all the questions I had. Is there any other information, Dawn, that you would like to give everybody?
The thing, people are terrified of the word hospice. I met with a family yesterday, and the patient looked at me and he said, "Are you with hospice?" And I'm never going to lie. His wife had told me, "Do not say hospice." I said, if he asked me, I'm telling him.
Right.
And he asked me, and he told me to get out of his house. And as I sat with him, I said, that's fine, I'll leave, but please explain to me why. And he said, I'm not ready for you. I said, you don't have to be ready for me. I said, we can do this at your pace. We can do this how you want. And he agreed to hospice services after a period of time because he knew that that's what he needed. He just didn't want to admit it yet.
Right.
And one of the things that we find over and over and over again is families tell us often, we get these, we send out surveys after a patient has been discharged off of services, and the surveys typically come back and say, I wish I'd done this sooner. You made my mom so comfortable. My dad was happier. He wasn't doing these treatments anymore and he felt better. We had quality of life. I wish I'd done this sooner. People are terrified of that word, and all it is a word. It's a word that's representative of a service that Medicare offers. It's the most comprehensive service that Medicare offers, and they pay for it 100%. They don't pay for anything else 100%. They pay for that 100% because it's just taking care of people when they need it the most.
Well, that is fantastic. I'm so glad that you guys are there to do what you do and to be such a comfort.
Yeah.
To not just the patient, but the families as well.
Right.
That's really, really impactful and very meaningful.
Right.
And I appreciate that so much.
Thank you.
So, and thank you, Dawn, again for being here with us today. I really appreciate your time.
Of course.
And I hope that this is information that everybody will appreciate. I certainly do. Thank you guys for watching. Hope you have a great day, and we'll see you later.